Hello, good afternoon, good morning, and good evening, wherever you're joining us from. And welcome to this other session of the Cameroon Town Hall. We are cognizant that today is a very busy day because of the African Cup of Nations playing today. So I think the Cameroonians we love football very much. So definitely understandable. But we also recognize that today is very important town hall session where we had scheduled to discuss about the Giveback project, this very important initiative that galvanizes some of the talents of the Cameroonian diaspora on ways we can give back to Cameroon, particularly in the healthcare sector. So it's really a pleasure to connect with you all again, and yeah, looking forward to a great session. Hi, Elvis, and hi, Dr. Mono. Elvis, first, how have you been?
Hi, Brian. It's been a pleasure being here again after the unfortunate situation we had in the last session. But certainly, this is going to be a very interesting session. We understand, as you said, Cameroon football lovers, and we are playing a match today against Nigeria. So most of our town hall participants might not be able to make it, but that's why we are happy that we're going to have this session recorded so we can get it shared to other participants at the end. But I'm doing great. How about
What
you?
I'm doing well. What was your hallmark of the week in public health? What major news did you come across that you
Malaria
think?
vaccine. Malaria vaccine. Cameroon has been on the news, and I felt proud that we took the bold step of being one of the first countries to adopt the malaria vaccine into the immunization program. A lot of stakeholders are talking about it. Different countries are talking about it. But at the same time, it's a very big challenge back in Cameroon because vaccine hesitancy is on the rise, and the anti-vax people are sending out a lot of messages discouraging parents not to vaccinate their children. So I think it's another call, just like during COVID time, for health experts to communicate more and using the different channels that anti-vax people are using the same methods that they are using, but I mean, being more clear to educate our public on the importance of this vaccine. There are a lot of things out there, but I think people like Mono, you yourself, and Bukuma can best inform the public about the importance of getting these vaccines.
Yeah, thanks, Elvis. I echo all those thoughts and sentiments as well. We were all really glad to hear that Cameroon is one of the first countries to lead in this effort in Africa. And as you know, Cameroon is one of the those countries with the highest mortality rate, particularly children mortality. So it's really been great to know that we are one of the first countries to lead that effort. So yeah, definitely I agree with you. We have lots of work to do to dismantle all the vaccine misinformation and disinformation campaigns that's going on. And I think we all have, as a community, we all have a responsibility to spread the right message. Thanks a lot, Elvis, for your remarks. And hi, Dr. Mono.
Hi, Brian, and it's really been an exciting how do I call it, week for me. Looking at things, it's the malaria vaccine is really the big one, as you said, and we're proud that I think the town hall we would have Dr. Bogumar Tikanji, who is a professor at Emory, come over to the town hall and really get to explain to the healthcare professionals how this vaccine came about, how safe is this vaccine, and we are hoping to get her in February. I think that will be an exciting session on the 24th of February so that we can talk about it. She put out a very short, eloquent message in English and Pidgin language, which was exceptional, which I shared. I hope we can keep sharing that for it to go viral. And that was my first real big thing. The second one is soccer, though I'm here. Le Continent. So I'm like, it has taken over social media. It looks like Cameroon is the one animating the African Nation Cup. So I am cognizant of the fact that a lot of Cameroonians may not make it here today because We are the ones really driving the African Nation Cup going on and it's full of surprises. So just pardon me to talk a little bit about soccer, about football. Let me call it the right way.
Wow. No, thanks, Dr. Mono, and thanks a lot for sharing that. I think even using soccer to communicate to communicate about healthcare and public health is also a very important and interesting avenue for that as well. And I'm looking forward to the session with Dr. Bogoma, where we will talk a little bit about the vaccine hesitancy issues and how which I think is problematic, and there is need for us to set aside time to discuss about how we can fight these disinformation campaigns. So it's a lot of work that I think we have a huge responsibility to do as a community. I do see Dr. Samuel Jinikad is here as well, and Dr. Samuel, we've missed you for a while, and welcome back. How are you doing? And I'm also curious to hear what has been the key hallmark of your week or the last 2 weeks regarding whether it's healthcare or it's public health. Dr. Samuel.
Hello, Brian. Hello, everyone. Thank you. It's really been a while. I really missed the town hall, and I thank God I am back. I was in Cameroon. My mom passed away. And everything went very well. And coming back to our hectic schedule here in the US, the week I have been trying to look more about when I got the alert on my phone about the malaria vaccine. You can imagine, like, I had to stop everything to really look at it very well. So I think I'm actually looking forward. I was going to text Mono to hear more about that vaccine, but I got caught down at work. Yeah, it's been a very hectic time for me. I'm still struggling to get back to normal routine. Thank you.
Yeah, thanks a lot, Dr. Samuel, and my deepest condolences for the loss as well, and really deep. So thanks a lot for sharing that, and
thank you.
It's great. Yeah, so thanks everyone. Since the session is being recorded, we will try to ensure that the recording and also one thing that we started doing starting 2024 is every session of the town hall will be converted into policy briefings, and then and also the minutes would be generated, and those will be uploaded on the Cameroon Town Hall website, which is currently under development. So every session of the town hall will have an accompanying policy briefing, which will be a strategic summary of what the discussions were, what the key conversations were, what the direct implications are, whether it's policy implications for the ministry or for stakeholders, and then that can be made available as well as the link to the YouTube page for those who would like to listen to the full sessions. But we're ensuring that we have those being documented every 2 weeks, so it's made available to those who are unable to join us during this session. Today we are pleased to have we are pleased to have among us Elvis, who needs no introduction, and he started the discussion last week talking about the Giveback project, and we're excited to have him continue that presentation and tell us more about the Giveback project and what the vision is and the goal. So over to you, Elvis.
Yeah, thank you very much, Brian. And once again, ladies and gentlemen, it's really a pleasure to be here again to talk about the Giveback project. First of all, let's just talk about what happened last week and the steps we have taken to mitigate it, because I'm sure a lot of people were really disappointed with what happened. So last week, this is a repetition of a session we would have had 2 weeks ago. but somewhere midway into the session, we got hacked by some hackers who got into the platform and were editing our slides or just disrupting our slides with screaming loudly. But we had a technical meeting at the end of the session to look at ways to mitigate such occurrences, and we are happy to say that we have actually identified some of the loopholes that we will henceforth cater for to make sure that such incidences do not occur again. So I just thought that I should once again apologize on behalf of the town hall for that disruption, but that we will continue to adapt and learn more ways to mitigate such occurrences. So once again, today we are going to talk about the Giveback project. And today we're presenting a concept note, which we intend to think that this will help members of the town hall also give some ideas of what they think we can, of how they think we can make this project successful. So let me put it in the slide mode. Permit me adjust my, okay. Okay, so the first thing is that this is an initiative of the Cameroon Town Hall for Healthcare Professionals, and it's aimed at just seeing how we can leverage the expertise of all the healthcare professionals that we have in the diaspora to help optimize healthcare in our different communities in Cameroon. So the Giveback project is essentially our project. All of us town hall members of the town hall, we are about 235 2,350 members now. So our numbers is increasing. And so this is our project. That's the first thing I would want us to take note of. And what's the objective of this project? I mean, we at the level of the town hall, we ask ourselves this question. We've spent almost 3 years having presentations every week, talking about very important issues. Actions have been taken. A lot of impact has been felt by our coming here every 2 weeks. But then now we ask ourselves, what if each and every member of the town hall decides to do something in their community, in their village? When we had this conversation, we said, okay, everybody at least comes from a village, right? It must not be where you were born. It could be just be where you grew up or where you identify with as far as Cameroon is concerned. And we said, what if each and every one of us does something significant in their village to optimize the healthcare situation in the village? That's just all about the Giveback project. What if each and every one of us between now and 2029 does something significant that will improve on the health center in your village or on the health of the population in your village? So the objective is to empower us, the healthcare professionals in the diaspora and at home, and to utilize our knowledge and resources that in order to enhance healthcare in our villages back home. And this will help really just address some of the local challenges that our health centers are facing. It could just be maybe you buying a blood pressure machine and some few equipment and donating to your health center or to your laboratory. So that will just be one of the ways in which we can improve on the community and the well-being of our people. So in order to do this, the first thing is we are going to provide a very easy need assessment template, which each and every member of the town hall can use. You can use that to just carry out a comprehensive assessment of your village to identify some of the areas where you think you are capable of making some impact. It's going to be a very easy assessment tool, and you can use it as well as you can just ask questions to people in the village and ask maybe the nurse in the health center in your village or the doctor or the community health or the health committee of your village. You can decide to not use the assessment tool, but just carry out your own direct health assessment by asking questions and understanding some of the challenges and needs that you think you can address. So once you do that, you can now really understand some of the specific local challenges that you think that is within your own area of influence. And at the end of the day, once you've already targeted what you want to do, we are also going to just have a simple project proposal template, which you can use to design that project by yourself. The reason for this is because you might not be the only one financing this project. You might want to reach out to your friends and neighbors and tell them, hey, this is a project I'm doing in my village. I need your support. So there need to be some kind of a short project proposal development, which will provide the draft for members of the town hall to use. And the proposal will be concise, practical, and aligned with the goals of the Giveback project. And once you do your proposal, you can now start mobilizing resources. So we encourage members of the town hall to personally first be able to contribute to this project. Then look at partnerships. Do you want to partner with is it your health center, your hospital where you're working here in the US, or maybe your neighborhood or your council or your friends or your meeting? Just see who you want to partner with to raise some funds for your project. And the project team for the town hall will also just provide some resources that can help you to mobilize funds, maybe some flyers or some maybe a fervent call from the town hall, or just encouraging and supporting your campaign for fundraising, so you can be able to raise resources or mobilize resources for the implementation of the project. Now, when it comes to project implementation, we encourage members of the town hall to collaborate with their local communities, the health center, the community leaders, make sure that they are really involved. And you know, when you identify the need, because you have to work with them to identify the need, you have to also make sure you work with them for the project implementation. And when we talk about the projects, when Brian will be presenting the digital platform where we will be reporting the project, you will see the kinds of categories under which this project can fall. You can have, it could be an infrastructure project, maybe like one Dr. Yauba was talking about, a friend of his that has just constructed a health center in the West region to cater for IDPs, or like the health center that Dr. Samuel has in Goketunja. Those are infrastructure projects as well. So if you're constructing or you are renovating your health center, maybe the health center in your village does not have maybe some doors or shutters, or maybe wind blew off the roofs and you are doing a renovation, that's an infrastructure improvement project. It could be capacity building project. Maybe you are a midwife and you decide to go back to your village to train the midwife, or you decide to organize some training online with the midwife in your villages to improve on their capacity. You have to cost what that means to you in terms of your time, in terms of the resources you're going to put in place. You can put that as a cost, because at the end of the day, we want to know how much did you spend on this project. You know, it could be your time, it could be all those you hired for the training. Your project could as well be just equipment donation, right? You could donate equipment, medical equipment donations. So we've categorized those projects on the digital platform, on the reporting platform. So it makes it easy for people to choose the kind of project they want to do. It could be a medical mission project, right? If you're conducting a medical mission to your village, maybe to screen people for glaucoma or cataract, and maybe provide some lenses, that is already a medical mission project. So all those are easily categorized for people to choose. So the project implementation should really involve those in your village, so they can be able to monitor the project for you and also be able to give you feedback on how the project is going. So we really emphasize that when you have done your project, right, you can report it on the digital platform, share your experience on what you noticed when you were doing this project, so that those who are still to do their own project can learn from some of the challenges that you had faced when you were implementing your project. Monitoring and evaluation is very important. So members responsible for assessing project progress and impact should really be constituted in the village. You can just decide and maybe choose one person in the health center to be the person that will keep an eye on how the project is going, and maybe give you feedback and continuous information on the impact of that project. On the digital reporting platform, we want to be able to see either a projected impact of what you think that project is going to provide, or an immediate impact that it has provided if it was a one-in-time project, so that we can be able to gather all this aggregate data at the end of each year and say what the impact of the Giveback project is to Cameroon, first in terms of number of lives that it has touched, but also in terms of amount of money that has been spent for this project. So for the knowledge sharing, as I mentioned, there is an online platform for reporting and sharing project outcome. Brian is going to present how that online platform is going to look like. We just have a schema of what that platform is going to look like. But the beauty about the platform is that it's going to permit each and everyone to, once you key in all the information and you click on submit, you're going to get an auto-generated summary, which you can share on your social media with the pictures that you attached for the pictures of the projects that were attached in the reporting platform. This helped to really share, the story of what you did. But also there is really some recognition that will come after you've submitted your your report. So we really encourage each and every member of the town hall that if you complete your project, you should be able to share that information on the digital platform. While we are launching this project, there are some people that are already conducting some health programs back home, right? So if you started a project and then we launched this project, you have the right to report it as a give back project at the end of the completion of that project. You can say, okay, because I already started this project, I don't want to call it give back. It's give back. We'll capture it as part of the give back project. So what's the expected outcome? As I mentioned, we've categorized this project according to different categories. Let's think about the infrastructure category. We'll expect to improve healthcare infrastructures in facilities, maybe the physical infrastructure or the healthcare that, if, like I mentioned, it could just be an operating block in your health center, right? Renovating it if it's in bad shape. So we want to be able to see those kind of contributions that will really lead to a robust and accessible healthcare system for our people. It could be capacity building, outcomes such like enhancing the skills of healthcare workers or healthcare professionals. If you, Mono did this last year, but it was not a give back project, but just organizing that kind of, capacity building for different healthcare workers. It could be if you're an oncology nurse and you want to train the oncology nurses in L'Hôpital Central, that's a give back project. All you need to do is organize the training, quantify what the resources will be like, and then, let us know what the impact is. So all this will serve as capacity building project. We also have access, right? If you just want to improve on healthcare access, we would want to see outcome like increased access to quality of healthcare for vulnerable populations. If that was your aim, we want to see such outcome. We want to see that maybe you've reduced the inequality in healthcare in your community by making sure that there are resources available for people to access care as much as you can. So access to healthcare is one of those categories that we want to encourage people to think about doing something in their villages. It could just be health education, right? Especially at this moment where we are talking about a lot of misinformation and disinformation about the malaria vaccine, right? So we want to see people do something to provide health education in their community. Maybe if it's just to increase vaccine uptake for children and pregnant women, that would be a very important outcome that we'll expect from this project. We encourage partnership, like I mentioned. We want that the diaspora should work very closely with local stakeholders to make sure that there is this partnership collaboration between diaspora. And I've mentioned before that it's a give back project, not just for the diaspora. Even those back home will be part of the give back project. So if you are a medical doctor from Bali, Nyonga, maybe you are working in Yaoundé, you decide to do something in Bali, Nyonga, that's a give back project, right? So it's not just the diaspora doing it back home. We encourage even those back home doing something in their village of origin or where they feel it represents a village to them. So the project timeline, we are launching this project this January because I think after this presentation, there will be a lot of work at the back end for the Cameroon Town Hall to do to make sure that people have the resources that they need to continue to write their project, or for those who already have projects going on, we want to make sure that the digital platform is available as soon as possible so people can start reporting their project. But we think that this project should go on for 5 years from now to 2029. The reason for this time lapse is because if you are carrying out an infrastructure project, right, we know it takes time for you to start constructing a clinic and to complete it if you are doing a project that needs time. But every year, we are going to assess the impact of the Give Back project for that year based on data that will be captured on our digital platform. And we're going to make a projection of what the Give Back project has been for that year. And then at the end of the 5 years, we are going to collect all the data, analyze it, and be able to see exactly what the Give Back project has been in terms of impacting the healthcare system in Cameroon. So that's why reporting on the digital platform is very important. That's the only way that we can be able to capture this data. Some people might not want to get their information. Some people want to do things, but they don't want others to know. So when you click the submit button, it's left to you if you want your project to be visible to every other person, or if you just want it to not be visible. So there is that option for anonymity if you choose to be anonymous in your project. So for sustainability, in some of those projects that really needs that there is sustainability, you have to be able to just think about how you're going to do to develop long-term strategy that will focus on maybe, capacity, community ownership, make this project in such a way that those back home should not feel like it's somebody's thing out there. Like it should be like some local ownership, and that will really enhance sustainability of the project. And you can continuously secure ongoing support and resources from the people that you contacted when you were raising money for this project. That's why reporting is very important. You provide a feedback for them that this is what I did. So if there is any other future call from you to do similar things, then you will still be able to get the same kind of support. So at the end of the day, everybody always asks, okay, what do I get in return? I'm giving back to my community. I'm giving back to my country. What do I get in return? The first thing is just that good feeling, right? A sense of gratitude for doing something good for your homeland. Everybody wants to feel good. When we talk about the Give Back project, and I after the meeting, somebody called me and said, Elvis, do you know I've never thought about what is going on in the health center in my village, despite the fact that I'm a medical doctor. Like, it's so easy to forget that you come from a village. It's so easy to think about the health center in your village and what's happening there, even though you are in a privileged position that you can do just quite a lot. But I think just that good feeling of doing something good for your homeland is one of the things you expect as a psychological return on investment. Also, we make it possible for you to be able to post on your social media platform the acknowledgement from the Cameroon Town Hall for Healthcare Professionals and also from the Minister of Public Health, thanking you for doing such a good thing to your people. So that is generated as soon as you submit your report, so you can share on your social media platform for people to see exactly the good things you've done for your people. That will also encourage other people to do the same in their villages. So it's very important. And there is a very beautifully designed recognition certificate, which we are going to show you a sample here, which the Minister of Public Health is going to sign, and the chair of the town hall is going to sign. Each region is going to have some vetting committees, one or two people that will be in charge of vetting. So as soon as you submit a project, somebody in that region is going to call somebody in that village or just do some vetting to see whether this project was actually conducted. It is only when the confirmation either from, because when on the digital reporting form, there is a place there where you have to put the name of a local representative that can be contacted to attest to that work you have done. It could be somebody in the palace, it could be somebody in the health center with their phone number. That will help the vetting committee people to reach out and find out about your work. Once they have confirmed, they have to click a button on the digital platform that sends you the signed letter of recognition from the minister. This is just to avoid that people don't just go get signed letter for no work done, right? That's why we don't want to make it auto. So there will be some vetting before you can get that document from the minister, which is really a gracious thing for you to have a letter from the Minister of Health recognizing your work, and also from the Cameroon Town Hall for Healthcare Professionals. So in conclusion, I think that this Give Back project, look at it, first of all, from your personal point of view, like what I want to do for my village. Before thinking about the town hall perspective of it, look at it from your personal perspective, like what can I do to give back to my village as far as healthcare is concerned? As a healthcare professional, as a nurse, as a lab technician, as a cardiovascular surgeon, as an oncologist, as a gynecologist, what can I do to give back to my village? That community that raised you up, that community that really catered for your growth, and safety while you were a kid or while you were growing up. So that's one of the things I think we should look at this from that perspective before thinking about it through the lens of the Cameroon Town Hall. And so it's a unique opportunity for the diaspora, and this might be the first time a diaspora of any country is doing something at that large magnitude to their country. And Cameroon might just be a very big model for other countries to copy if we do it rightly, if we report it rightly, and we are able to capture and measure the impact. So this will really lead to some meaningful contributions to Cameroon's healthcare system. And we hope that the Cameroon Town Hall is going to be able to have the resources and the volunteers. And if you really think you have some time, you can volunteer on this Give Back project, please indicate, because we'll need some volunteers to volunteer their services as we continuously plan on how to coordinate this Giveback project alongside the ministerial committee in charge of diaspora, whom we have members like Dr. Samuel here represented. So thank you very much. I think this is what I had, while we would also give the opportunity for Brian to present the digital reporting platform before we go to the questions and answer session.
Yeah, thanks. Thanks, Elvis.
You're welcome.
Yeah, and thanks a lot for, I think, I don't know if my screen is visible.
Yes.
Okay. Yeah, so so thanks a lot for that presentation. I think it's just a microcosm of the possibilities that we have when we work together, and all the things that we can accomplish. I think the opportunity to give back is so important, and it's so integral to most of us, to the desire to give back and to help our own local community and our own local villages. So thanks a lot for that presentation. I will just make a brief demonstration of what of how a project, just like Dr. Elvis outlined, how a project could be submitted through the town hall. So the town hall website, it's under development. It's just a rough sketch, but I'm hoping to the IT team is working on this. I believe they will perfect this as we go along. But there is a tab here, and I'm going to drop this link in the chat, or maybe Elvis, you can help me drop the link in the chat, where you can visit it. And there is a tab right here where you will see the button to submit a project. This page is going to be updated as we move along, as we get more and more ideas and feedback from many of you who are here and others who will listen to this presentation. Eventually, we will welcome most of your feedback so we can perfect this. But one of the ideas that we already had, and I spoke about this a little bit earlier, was to design the website in such a way that some of these recordings and information can be easily transitioned from onto the web server. So those who are not able to participate can have access to the meeting minutes, the policy briefings, the presentation slides, and then the recordings for each of the Cameroon Town Hall sessions. So this is currently being hosted on a GitHub repository, but we are hoping to push all of these changes onto the website. So when you click on that Giveback project, it's going to take you to a page that looks like this. And on that page, you will have, this just looks like a simple survey form, but here you can input information regarding the project. So let's say if I wanted to do a donation of 1,000 mosquito bed nets. This can fit within, and here in project category, you can put that as maybe medical equipment donation. But if it's like Elvis mentioned, if it's capacity building for healthcare workers, if it's training people, you can put it under capacity building. If it's delivering health education talks, for instance, it could fit under health education. It could be a financial donation in general, etc. So we will expand this more and more as we get more and more feedback, but this is just a rough sketch of what this would look like, where you can categorize the specific give back initiative you have in mind. Here you can put the name of the village. So here I'm just going to put Bali district or Bali village. Then here you can type a brief description of what the project is. Here it just has to be about 250 words, but you can summarize and just in a very, very succinct way write the you can write just a brief description. So here I'm just going to write provision of bed nets just for demonstration purposes. And here you can enlist the number of beneficiaries. So if you're donating this to multiple community health facilities within the Bali district, you can enumerate those here as well. So here I'm just going to put 1 to 10, but this can be expanded if you're doing more. If it's less, you can also expand those there. And you can also estimate what the amount is. It could be $100. It could be $1,000. It could be $100,000 or whatever it is, and then you can fit that in there as well. So this is an estimate of what the amount you spent or what your projected expense is to maybe purchase, for instance, in this scenario, to purchase mosquito bed nets. And here you can upload pictures that can help show some of the project activities that you intend to outline. So here you can upload up to 10 photos, and this can be helpful for those evaluating it. Then here I can put the names of the beneficiaries. So here I could put the Bali Medical District Hospital or Medical District, which might be a beneficiary of this initiative. And here I can put, I'll just put a random phone number. Yeah, so, and you can put as many, but I think at least one phone contact is always very helpful. So someone from the Bali district, it could be the district medical officer or the medical director of the district hospital in Bali, for example. Here you can put your name. I can put my name, Brian Tegomo, and I can put my email right here. Same here, put a phone number. Put your address, how we can get a hold of you in case we have additional questions, and then any comments or messages that you might have, or any additional messages or comments that you might have. And then you click next to the next page, and then it will give you a preview of what you wrote. So just like a brief summary of what the entire project is. So you can read here, we have the project name in mosquito bed nets, we have the project category, we have the village, we have, so just a succinct summary of what it is. And it will be possible eventually, as we are working with the IT team to build this, to download a PDF version of this project summary that can be extracted in a Word document or in a PDF format, so it can be printed, and it's a lot easier. So I think we're working on that, and we will try to perfect it as time goes on, and then you can submit that project. And once you submit it now, it'll be easier for us to see through the platform. And this will enable us to collect data regarding what the impact of this project is. And I think after you submit the project, that's when you will have the recognition certificate, and it's been evaluated. That's when you get the recognition certificate from the minister himself, and then I think that's how the process is going to look like. So this is a platform that's still under development. So as we learn more and as we get more and more feedback, I think this will be perfected. I know the IT team is working very hard on the back-end components of this, and then as soon as they are done, they will give us feedback. But we just wanted to make a brief demonstration of how, if someone wanted to start up a project, how you could do it. So I think that's it for me.
Great. No, thank you very much, Brian. And this is really great. And thank you for presenting this platform. This is just the work that is going on. As he mentioned, the IT team is still working on it, and the website is also still being developed in a way that will have all these things integrated into the website. So at this point in time, this is the end of the presentation. We'll hand over to Muno to give his own preliminary comments before we open up to question and answer. Over to you, Mona.
Yeah, Elvis, I just want to thank Brian and you and the IT team for the wonderful work you guys have been doing behind the scenes, and also to thank all of the town hall members for their participation. I think the brilliance about this project is that you decide what you want to do. You decide how you want to impact healthcare, and we are just going to be there to accompany you and facilitate things, because we have the backing of the ministry in order to help. the ministry has given its words, which we can, and we have the Diasporan Committee where we can also help you get, as much as you're doing charity, we can help you get things to Cameroon, get things done, be it financial, be it material, be it knowledge. So this, and also where you feel like you want to make a difference. You may want to make a difference in Mwa. You may want to make a difference in Twerere, or you may want to make a difference in Bamenda or in Yaoundé. So, or you want to make a difference in sickle cell, in a disease in particular, which I hold dearly to my heart. You may want to make a difference in breast cancer. You may want to make a difference in cardiovascular disease. Whatever difference you want to make, you could decide on how you want to do it. Do it at your own terms, but the ministry is going to be able, as much as it's charity work, to help you. Though the ministry is also able to help those who want to do investment projects in Cameroon and make sure that they do it the right way. And the town hall is also going to be able to try to facilitate some of those projects. So Elvis, I think it's a very brilliant idea, and I want to thank you for your brilliance always, and for Brian's brilliance in implementing things once things are spoken to him very fast, and getting this running within a period of just, I think the idea to where we are, it's been amazing. So without much ado, and I know we have limited time, let me allow the others to talk so that we can round up quickly and allow time for people to go watch the match. I know it's a very important day, and you cannot take the last 2 weeks before we're hacked, we're almost 16 participants or 65 before the hacking. But today you see it's just 23. So people really love football in Cameroon. So over to you.
Yeah, thank you very much, Chair, and thanks for your leadership always. You've kept the ship sailing afloat all this while, and so we really appreciate it. So we'll open the question and answer session, and we're going to start with Dr. Samuel.
Thank you very much. Thank you. I know you and I, we have talked about this topic, and you can know how so dear it is for me. I wish when we started our project in Cameroon, the town hall was existing. And quickly, around 2010, I think the statement, this give back, the way you presented it, I was by then we didn't have the social media that we have, but there was a Donga Mantum group, e-group. I don't know if we remember of those e-group in those days. And I think through email, I responded to an email that if each of us can go back to our own local area, not only in health, just do something back home, we will develop our country. And Dr. Nick Ngwanyam followed up with me after and was trying to ask me what I'm doing. By then, I was just finishing school and actually working to open a clinic in the US. So you can see from that time, my approach of thinking just from little conversation changed. And that is how we got into. And he was so passionate. You can see what he is also doing in Cameroon. He's in Cameroon, and you can look at the project. So we became good friends since then. And he said, hey, I work with you. Whatever you are doing on the ground, we can connect. And why am I bringing this to connect to what the town hall is doing now with what we have been doing on the ground? When we started, we needed to understand. We didn't have the support of the ministry. We were trying to understand more. But today, if you have the town hall that can help you even with the project proposals, I mean, guiding you along the way, this is going to make a huge difference. So we started by having a foundation to working with the Prime Minister's office. And today we have a hospital where we see an average of 400 patients every month. And I believe that not only just having a gratification, the recognition we have had from the ministry, from the government, and I have been to Harvard, I have been recognized even with the Biden's administration, even on our sickle cell project. You can see that you can make a difference at your own little corner. But now, this is so important that we have the town hall and we have the backing of the ministry. We have the working group, and putting our resources together will also avoid duplication moving forward. I've been to a conference in Europe, and one of the challenges we face in Africa is that I might be doing something in Dop, and you are doing something in Dongamanto, even though we're close and not that far, not to talk of somebody doing something in extreme north, where if we were to work together, especially in knowledge sharing, as you mentioned, that will help us move faster. That will also avoid you trying to reinvent the wheel, as we will say, in something that somebody already have a plan. So I believe that this is one of the greatest, it will be one of the greatest achievements of the town hall. And I'm happy we're already at the working group. And those who will want to join, we have worked with the Ministry of External Relations, the Ministry of Public Health, the Prime Ministry, and other ministry, which will help facilitate, and they will not have to go through what we went through. So I just wanted to commend you with, and Brian, also everybody working on this project. I believe this is something that we need all of us coming together, putting our talents together, looking for resources in order to see this succeed. It was more for me a comment, but the question that I would have had would have been, what about those of us that has already been existing, but you already answered the question. So we'll be looking forward. And I believe with the working group, the success stories that we're looking at, if this project works well, we will be able to provide the ministry with success stories. Thank you very much.
No, thank you very much, Dr. Samuel. That is a very interesting analogy you've given there, and just using your example to show that how that feeling is when you do good back to your people. And seeing 400 patients every month is not a small impact, right? It's a very huge impact. And going forward, I know there are still things you still do to that particular health infrastructure. There are times you still deploy some resources there and things. So anything from now henceforth that you deploy to make that place better, you have to report it again as a give back project. And so it's still a very big opportunity to continuously report that work that you're doing. So thank you very much. So we have Franklin Maloba's hand is up.
Yeah, good morning, Town Hall. Yeah, it's always a pleasure to be here. Yeah, I think first thing to do is to really thank you guys for the great initiative, because the truth is there are many people who are willing to give back home, but they don't know how to give back home. And Town Hall seems to be playing that role. And I think that going to different platforms to expose what you guys are doing will really maybe bring this type of donors back. Secondly, many people also are willing to give back home, but they don't know how to get traceability and accountability. And Town Hall, I believe, is acting like that platform that could also bring that traceability and accountability for what they have donated, which is something very good. Yeah, so my question is, some of us are still very young scientists. We don't have that much to take back home. Like, for instance, I have a master's student that I want to help because he's doing an interesting research, but doesn't have the reagent because he wants to do some DNA extraction and sequencing. So he was asking if I could be of help. And the truth is, I think that I can buy some of this reagent here, but my problem is who can take them back home to give this student. So I don't know if Tango have any means through which such things, they have a means where we who can give some of these reagents to this student, they can easily transport it for us so that it can reach a student in a good way, because some of these reagents too, they need to be transported under better conditions. So I would like to know if there's anyone here that can be of help to me so that I can order the reagent, because I wanted to order them, but I said if I order them, I keep them here. How would they get to Cameroon? Because his defense will be in September and he needs to start his research immediately. So I don't know if Tango is looking into this stuff, like in terms of research, like many students are really suffering in the research area. I, for one, I could not actually defend my research back home because I did not have reagents. So I actually went to the malaria control program at that time, they told me that they did not have funding for research in malaria, for Rubank malaria program. So I do not know if I was thinking that maybe for some of us here, trying to support some of these students, it can go a long way to empower them. So who and how can I get my reagent to reach to that student in Cameroon? Thank you.
Yeah, thank you very much, Maloba, and really thank you for always showing up to the town hall. You're one of our fervent participants. We really thank you for your interest in the town hall. And of course, as we've always said, the town hall is a place where you can make your open appeal, right? Like an open appeal, and anybody at individual level, please, you can inbox Franklin if you have a way you can help him get that reagent to the student. And I agree with you, really, helping students back home is part of the give back, right? We just have to be able to report it to in the project format that shows that this is what you were able to do. If it was a group of students, you help them, supply them with reagents, because training is part of healthcare, right? If these students get trained and they become better scientists, then they're going to improve on the healthcare system, right? So training is part of the segment in the project reporting area, which we mentioned. So if you see how to tie that to that, then you can as well report that as give back. But for the immediate concern about how to send your reagent, I just hope that someone in the town hall who has a solution is going to reach out to you, and we'll continue to put that request out there to just to know if there is anyone who has idea on how you can ship that reagent to that student, which is highly needed. So thank you very much for that. So the floor is open. It could be a question, it could be a comment, it could be your thoughts about the Give Back project. It must not be a question. It could just be maybe some comment around it. So we welcome everyone to participate.
Hey, Elvis, if you don't mind, I just wanted to add to Franklin's point. I think we do have an email. Let's say if I got that information like last month, we just ship things to Cameroon. So there are many of us in this town hall that we're doing a lot. I think the chair knows we shipped a container 3 months ago, which if somebody had something going, and this is none that is going to go through, we have contacts at the ministry. So now the town hall will be the better place for others. If you need help getting things, yes, please. If we get the information in advance, we can always be of help.
And I got a very interesting news there last week from Cameroon, that the Cameroon government has removed all taxes on all medical equipment being imported to Cameroon. That was a great news.
Wow, that's interesting.
Yeah.
Well, so I hope they should update there has been a document that was supposed to expire December 31st of 2023. So I hope it's the same document, because that document gave exoneration for all medical equipment and medical supplies.
Yeah.
So by the time I left Cameroon, they were planning to prolong it.
Yeah, I think that's maybe it was a prolongation, but I got it on their national news, and they were saying that this was a very great move that was going to improve on the health system. So, but just very important news for those who plan to donate medical equipment, to send medical equipment back home.
Yeah, please, I've just put my email and number there for anyone that can be of help for the reagent. Yeah, thank you. Yeah.
Great.
And Prof, there's Professor Theodore Gatcher. You have the floor, please, Prof. You're muted.
Yeah, I don't know if Prof is able to talk.
I'm really sorry, guys. I'm actually sitting on the plane.
We are just waiting to finish last
I
paper
will not be
right
able
now,
to
and
talk
then
because of
to
environment.
Okay, Prof.
31 minutes.
It's a great job you guys are doing.
We should be in crystal slide.
Thank you, Prof.
Yeah, yeah, Prof was just letting me know that
LTC.
Prof just letting me know that he was taking a flight, so he wasn't able to talk. But the key message he wanted to transmit was the Cameroonian diaspora is very huge, and many people in the diaspora are giving back to Cameroon in very small ways and very different ways. And this platform is really a great opportunity to harness those efforts together. So it's it's more synchronized and more organized in a way. So some of the message that he wanted to transmit, that we need to come together in order to harness these efforts and make a much stronger impact.
Great.
Yeah.
Yeah, very true, Brian. And there are some people that want to give back. They are not healthcare professionals, but they want to give back to their village in healthcare. So if you know of that person, please help us capture that as a give back project, right? It's a town hall for healthcare professionals. But if you have a friend that is not a healthcare professional, but who wants to do something in healthcare in their village, this could also be a very good way to orientate that friend to get to the town hall to get that reported as a give back project.
Sounds good.
Yeah.
I also just wanted to another comment to Dr. Maloba. There was a liaison from the ministry was here last week for one of the representatives. There is a person that's in charge of research grants at the Ministry of Public Health, and that could be aware of such a grant that can help support students. I know students who have difficulties with getting money for reagents, but sometimes it's just helping point them to the right directions. Because when you mention sequencing, and I know how much effort it's been globally, not only in not only in Cameroon, globally, how much effort is being put into sequencing. There's been a lot of money and just needs for people with projects and grants, well-written plans and projects that can be easily funded if those are channeled to the right sources. So I think I'll try to get in touch with you after this. There is a person that can help take a look, and if that's a project that is that can be evaluated and that's feasible, that student can get all the support that they need. So I think
okay, thank you very much, Doctor. I'll try to contact you after this too. Yeah.
That's very good to hear. And then
Yes.
Noela asked a very interesting question in the chat about must this project be carried out in your village? I think the concept of village was just to add emotions to the Give Back project. When you talk about my village, right, it's emotional to me, but it must not be it must not be in your village. A Give Back project anywhere in Cameroon is a Give Back project. It depends on you. It depends on why you choose to do it, where you are doing it. So it's not limited to your village, but we just use the village as one of the most basic elements of identification to say that if you are a Cameroonian, the first thing you really want to identify with is your village, right? It could be where you grew up. It could just be some place where you've lived for so long that you think it represents your village. So it could be anywhere that maybe the impact of that project will be felt most, right? So the village is not a limitation. It was just a way to make it really have that emotional component of why you really want to give back. So I think we are exactly 2 o'clock. This will go into history as one of the shortest town hall session because we have a very important match that is coming up. So I want to give it back to Brian and to the chair to wrap up the session if there are no other questions.
Okay, so thank you, Elvis, and you've kept your words. If it was me, I think I'll keep going and talking. And so you guys and Brian, you've kept your words. My last comments are really to thank the diasporans, to thank the healthcare workers back home for not giving up. And I think we can make our governments responsible. We can do that by trying to not just sit and complain, but initiate projects which, if they don't support them, then we can hold them accountable. If they don't participate in those projects, we can hold them accountable. There's time to ask what our country has done for us, but really now it's time for us to ask what we have done for our country. We have been complaining for years now. What have we done for the healthcare? Can we improve? We complain that the education given to doctors is inadequate. What have we done to improve it? We have complained that we have never trained infectious disease doctors in Cameroon, despite Cameroon being a country with high level of infections. We've never trained any infectious disease doctor. What have we done about it? We don't train hematologists in Cameroon. What have we done about it? We don't train, we are not able to adequately provide blood products to our people back home, meaning that we can do transfusion of blood, but how about platelets? How about plasma? How about concentrate for those who have different things? What have we done about it? I'm just taking my specialty. What have we done? What have we done to fix this problem? Cameroon has one of the highest burdens of sickle cell. What have we as an individual done? Have we even done a situational analysis? Have we proposed a strategy and the government has not used it? Have we called for, they have a lot going on too, and they have limited resources, and there's also poor management, which we must say, but we can't just keep complaining. We need to move over to action. So I'm someone who believes that by the way this has been put, we are not asking for money from anyone. We are not going to financially manage your project, but would help you to make sure this project goes through. And the town hall, others would testify, just during a short lasting, we have helped many diasporans, which I'm not going to call names, through contacts, get permissions to open their centers back home in Cameroon, which was almost impossible. Even they were told by the delegates, Cameroon has stopped opening healthcare centers, you cannot do it, but the town hall has made that happen. And others need to know that things like this can happen. We can get projects. You're going to manage your project. We are not going to manage your finances for you. So you will be able to report. We'll just make sure that this is something we can audit in order for us to know that that's what you really did. So I think it's a wonderful idea, an excellent project. And I hope our next sessions, we start turning these ideas into implementations. And Elvis, I'm really very excited about this. So I will say thank you to you, to Brian for the hard work, to the IT team, and to every other diasporan who takes time to participate in the town hall. And thank you for closing early. I'm in DC also for an oncology meeting. I had to dash out in order to participate from this session. So thank you very much.
Yeah, thank you, Chair. Brian, any last word?
No, thanks. I think there's power in unity. So it's really great that we can harness these efforts together and do this. So I think there's a lot we can achieve when we work together.
Yeah, thank you very much, Brian, and to all of you, thank you for coming, and I wish you success. They said you can only test for how good your heart is after watching Cameroon match. So I hope all of you have good cardio reports at the end of the match. Good luck to all of you football lovers, and hope to see you again in a fortnight. Thank you very much for showing up always. Sorry, I shared the wrong. Did I share the wrong stuff?
Not yet shared, I think so.
Okay, yeah, I think it's not yet shared. I'll share the jingle to the session. Great. Thank you all. Since there is no parking lot today, all I can say is goodbye.